So take two.
Well, we're back with Morning Coffee. It's the Al and Joe Show. And Al, this is a great segment we're having right now.
I love this topic.
It's part of the expert series that WorkCred is sponsored and everything.
Mm-hmm.
And this is something that nobody thinks about, and it's so important in the healthcare field.
It's needed.
Absolutely. So we're gonna introduce Roy from WorkCred first of all, and Roy Swift. And Roy, you're the executive director. Would you like to take and first of all tell some of our viewers about WorkCred, then introduce the two professionals you have next to you, because
Sure.
I think it's very great.
Well, WorkCred is an affiliate of the American National Standards Institute. It was created to look at the quality, market value, and effectiveness of workforce credentials, and which is a major issue this day as we build a new and frankly technologically smart workforce. And today I am just so proud and excited about having our friends from WorkCred here at Sterile Processing. Mm-hmm. And Siri and Damien are involved in the certification, and they're going to talk about the certification process and the careers that thousands of people have. We know that many of the think tanks, such as Brookings and the governments, are saying that there are multiple ways to good pathways in careers, but many times the public does not know what they are. Mm-hmm. And this series is really meant to educate the public about what wonderful careers that have good living wages in this regard. So I'm very excited today. They're going to tell you all about the importance of this particular career and everything. And Damien, do you want to start off?
Sure, I can start off. And first of all, thanks for having us on board, having me on board today's conversation. I'm coming to you from Colorado, so I definitely have my coffee with me this morning, but I'm good to go. So, so thank you again. And again, Roy, you hit it right on the head here, and my counterpart, my colleague, Siri Sorensen will elaborate more on the certification process that we have at HSPA, which is the Healthcare Sterile Processing Association. So we are the leading certification and advocacy membership body for the United States. We even have a global international reach too. And I'm one of those stories that we're talking about. I mean, I joined the military at age 17, became a medic, did the traditional route of using my GI Bill, going to college. But then after several deployment stuff, I got out and I'm in the civilian world. I'm working at a hospital doing surgery or doing different jobs as a tech. And it's just one of those things where I fell into and I discovered the sterile processing role in the military because they have the same thing there. And it just was a thing. I got bit by the bug and I got certified. 2006, I believe, is when I received my certification from HSPA back then. And I worked my way up the ladder. I've been everything from a technician on call to an educator to a team leader to a manager to a director. And now I have the fortunate position, I'm Vice President of Strategic Initiatives, very long title, for HSPA. So I get to represent our profession, and that's where I get to talk to people. I get to go in the hospitals. I meet with legislators. I meet with industry experts. I meet with people like you guys to promote this important career so people know that it's out there, number one. And number two, that they pay attention to it because it is one of those things where you can have the best surgeon in the world, you can have the best nurse in the world, you can have an outstanding medical institution, but our technicians are the ones that clean, inspect, disinfect, and or sterilize the surgical instrument that these professionals use. So if our people aren't doing that very crucial job to its way it needs to be done, then it's going to impact the care of the patient throughout the entire stay or their visit to the hospital. So that's where my passion lies. And I got here a kind of non-traditional route and I fell in love with it and I just love what I do. So I'm here to tell the story.
So important.
Hey, Damien, thank you. And Joe, I just want to do a shout out to the military. I'm a product of the military. I used to be head of the Army Medical Specialist Corps, head of rehabilitation for the Army, and I hopefully am contributing civilian. And you just heard Damien talking about how he transitioned the wealth of talent that the military moves and puts into the civilian world is unbelievable. People don't realize how much talent comes out of the military. The military really is an opportunity that people do to build their foundation, and then they go on to bigger and better things. But I just wanted to point that out, Damien, because I'm so proud of your story, because I know that the medical departments of the military have served the civilian area well. So sorry, Siri, so I had to answer.
We didn't forget about you. So Siri, take my audience to your world right now.
Sure.
As Director of Certification and Membership, I've been with HSPA now for almost a decade, although we are over 60 years going strong. And as Damien mentioned, we've been working really hard to highlight the importance of the field and promote the field in general. It's so critical to the hospital facility, and it's definitely been growing and changing over the past several years. So we've been doing a lot to highlight that and to elevate the field and promote it around the world.
Well, you know what's so interesting is, like you said, Damon, you could have the best nurses, best doctors, whatever, but sterile processing professionals are the heart of this too. You can't go anywhere else until you start there. And I don't think people understand it. We take it for granted. We take it for granted that something's always going to be sterile, et cetera. So what I think you're introducing to our audience is the importance of what you're doing and the importance of certification of these kind of professionals.
Yeah, so you talk about the science, or Damien, either one, of the science. I don't think people understand the science behind all of this that you have to know.
Yeah, it is not, and I'll let Siri talk about how the certification process works, because I'll tag it into that, because that's a very important piece to what we do, because it's not just taking a test. It is learning a skill. As like you said, there's a science and a skill behind this. So yes, the people have to read, they have to study, they have to do all the things that are required to get your certification. But we also have something unique here, where it's 400 hours of hands-on learning to complete your certification, which is not a classic certification model, because this is a tactile job. You've got to actually know the surgical instruments. You got to know how the surgical instrument works. You got to be able to do the science. We read biologicals, which means there's actually a bug that we sterilize, and then we incubate and see if it grows out or not grows out within a certain time period. That tells you if that load in the sterilizer actually did what it's supposed to do. And that's just one of many different scientific things that we do. So it is not the same job every day, because the surgeries aren't the same every day. Some places they are, but our tasks are so vast. I mean, in the facilities that I still visit and I still work in as a sterile processing tech, there's surgical instruments to this day that I see that I've never seen before. And I've been doing this a long time. So it is very challenging, but it's also very rewarding at the same time. But the certification process, Siri, can you expand on the rigor that we as HSPA put behind that, so that people have that knowledge to employ that skill?
Before this interview, I thought sterilizing things was a task that doctors do and that nurses do, but I hadn't really thought about it as a career opportunity until this interview. And how lucrative an opportunity is it?
So it depends on where you're at around the country. That's with a lot of different jobs out there. So I can speak to my region. And again, in the healthcare scheme, it depends on, again, do you have your education, your basic fundamental high school education, and then your certification. And we at HSPA have multiple levels of certification. So we build upon the skills. We have our entry-level certification, which is called CRCST. Then we have some specialty certifications. We have some leadership certifications. We have certification just around people who process flexible endoscopes, because it's such a critical task. So as you obtain more certifications in the different hospital systems, if they have that career path, you can attain the higher levels of money. I think a survey, and Siri, correct me if I'm wrong, just got put out by another national publication. And I want to say the average technician salary is increasing every year across the country, and some are right around that $60,000 a year range. Again, that's national average. It's not, where you live. But we work with this other publication to do a survey to find out, what kind of people are there, what kind of education they have, what's their base salaries, so on and so forth. But it can be very rewarding, and I can tell you, just as someone who's worked it myself, from the entry level all the way to the highest levels, that I was able to take care of my family. I was able to live very comfortably. But again, it's not without being ready for the challenge. I just didn't go in there and say I'm going to work and not get certified. I'm going to go in there and do it, do the best job I have, and get recognized for that.
Siri, tell us, our audience, a little bit more about the HSPA, please.
Sure. Siri, you want to cover that?
And I probably missed the end of the question, but the HSPA certification process.
Yes, please do.
There's two different pathways to earning a CRCST. So you can always challenge the exam without having the hours first, but then you would want to make sure that you get your foot in the door to have a place to go where you can complete those hours. And we've been working with a lot of different schools and hospitals in order to set up those opportunities for people to ensure that they can complete those hours. The other way to do it is if you have those 400 hours of experience. So if you're able to learn and gain that knowledge, whether it be in a hospital, surgical center, then you could do the exam with your 400 hours to earn a full CRCST. And as I mentioned, there's different pathways to doing that. We don't require a formal education for that, but there are a lot of schools out there, whether they be junior colleges, 4-year degrees, that are training in sterile processing, and that also use our certification toward a portion of your degree. So that's always a nice additional bonus there as well.
Yeah, the national research, Joe, is showing that work and learn type of occupations are producing people who are, first of all, are assured that they have the competencies as advertised. And secondly, they tend to be the most loyal and retainable employees because they have developed a loyalty through the work and learn model. So this approach is really the hot approach in some respects for a lot of certifications, not just this one with sterile processing.
Right.
Wow, great.
And Joe, I want to tag onto this, and you kind of alluded what is different about HSPA,
Right.
and not only our certification, and as Roy said and Siri said so well, we've got the rigor behind it, and it is becoming the habit. HSPA does something different. We are also a membership body, and we do a lot more for the hospitals and the members. So it's not just get certified and go on your way, we forget about you, thank you for your money and your time. It is, we invest in you, we invest in the person doing the job. We spend a lot of time and effort behind the scenes with our membership bodies, putting out great continuing education. So it's not just about getting a certification, because as I told you, this field is evolving, technology is evolving. We do surgery with robots nowadays, and it's very, very prominent, but it's a very complex medical device. So our technicians, you could get certified 10 years ago, but do you know how to properly inspect and clean and sterilize this robotic arm, this instrument that the surgeons use for amazing surgeries nowadays? So we continually do that stuff. Plus, we have an advocacy wing. So we're working across the country. Right now, there are 5 states that require certification, and that's through us. We push that advocacy. We meet with the state legislators. We meet with the hospital leadership, and we say, this is what's important about it. And we're working across the country to continue that push for not only certification, education, but also acknowledgement that this is a valuable profession and anybody can get into it. But you got to go through the steps, and you got to have that passion.
Really important stuff. We're out of time, I
Right,
guess.
we are. You know, and thank you for introducing us to, and my audience, to the world of sterile professionals. Nobody really thought about it before, and how important it is.
Great
So,
interview.
Yeah, would you two really kind of tell my audience where they can get some more information, how they can contact you if they want some more?
Always go to myhspa.org. That's myhspa.org. There's a wealth of information on the website that you can check out and let us know.
Great.
Well, listen, thank you so much, the two of you. It's such a great profession people can look at as a great lucrative career, something that's so important
Definitely.
for healthcare. And Roy, again, thank you for introducing us to such great professionals as Siri and Damon. And,
Happy to do it.
And we'll see you again for another episode of the Expert Series. And Siri and Damon, thanks so much for joining us.
No problem. Thank you.
Thanks so much.
So,